It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Our next guest, Dr. Eric Peng, fellowship-trained orthopedic surgeon. He specializes in hand, wrist, and elbow disorders. We're talking about wrist fractures. He can be reached, by the way, get more information about him at ericpengmd.com. Wrist injuries, Shannon, not all that uncommon. You fall, brace yourself, or maybe you're just overusing them, but that's certainly an important part of what we do each and every day with regard to writing and much, much more.
Another complex area and joint of the body, 2 bones in your forearm, multiple bones in your hand, connecting in contact with ligaments, nerves, muscles, tendons. Very complex area. And you know, Tom, I'm very impressed that you noted that a fall on your wrist is the most common way to fracture it. Good job on that.
Because I've done it. All right, here's Dr. Eric Peng and Shannon O'Kelly.
Dr. Peng, welcome to Health Talk again. A little while ago, you came on the radio, and at that time, you were kind of just starting your practice here in Seattle, and you're a hand surgeon. And so tell us what's going on in your practice and some of your areas of interest and what you like to do.
Yeah, absolutely. Things have been going well, barring the, global pandemic and everything. Building up the practice and just kind of getting things moving, making sure people know that, OPA, which is the group that I joined, that we kind of have new services and whatnot. As far as things that I'm interested in, I still got into orthopedics, I think, because I liked, fixing fractures and taking care of trauma kind of patients. And those are the things that I'm still interested in particular upper extremity related injuries. And that's a big reason why I chose to specialize in hand and upper extremity surgery. That's what we're going to talk about here today, so it kind of ties in really well.
Yeah, absolutely. We're going to talk about wrist fractures. Let's talk about the anatomy of from the elbow down and the wrist and the attachment to the fingers, and very, very complex area of the body when you talk about tendons and ligaments and nerves and connective tissue and muscles. I mean, it's just very complex.
Yeah, no, absolutely. I mean, it's very intricate, very delicate, and those are things that kind of drew me to it as well. Just briefly on the anatomy, it's kind of hard to describe just in words, but, there's 2 bones in your forearm, the radius and the ulna. The radius is the one on kind of the thumb side of your arm, and the ulna is the one on your small finger side. And those are your forearm bones that they talk about when you're kind of referring to that area. The kind of distal radius or the wrist is the junction of those 2 bones with the carpus, which are the smaller bones that make up the wrist that allow you to kind of flex and extend your wrist, like when you're doing push-ups, for example, getting your wrist into an extended position or flexing in the opposite direction. And that's kind of the articulation between the forearm and the wrist that we're going to be kind of talking about a little bit more today as far as fractures, as it's a pretty common area to be injured.
Let's talk about the mechanism of injury when we talk about wrist fractures, maybe types of wrist fractures.
The most common way that people are going to injure their wrists are typically high, impact falls. People that are riding their bike or, on their scooters or falling from a height onto their kind of an outstretched wrist, trying to catch yourself. That really kind of dictates how the fracture kind of develops. So, if you're on a motorcycle and you're going 100 miles per hour and you fall on your wrist, it's going to be a little different than if you're just falling from a standing height onto your wrist. But either way, though that's kind of the most common way that happens, just an impact on a kind of an outstretched wrist and in an extended position. That's definitely the most common way things happen. And that happens a lot in sports, anywhere from soccer to football to snowboarding to biking. Anytime you take a fall like that, that just is kind of a very common way that people react to that event and subsequently have these injuries. I talked a little bit about the force that is imparted, and that's really the big kind of key player in terms of how bad the fracture is going to be. Typically the radius bone, which is the thumb side bone in your forearm, that's going to be injured most commonly, but you can break both of the bones, which would usually happen at the forearm level, but can happen at the wrist level as well. When that happens, it's a much higher energy injury. In addition to that, the more force that's imparted, that can break it in multiple places. Sometimes you get one clean break. And when that happens, obviously it's a little bit easier to deal with compared to those that have kind of multiple breaks.
More with Dr. Peng and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Let's continue our conversation with Dr. Eric Peng and Shannon O'Kelly.
Dr. Peng, again, thank you for joining us and describing wrist fractures. That's what we're talking about today. And you mentioned the radius and ulna and the carpal bones, et cetera, some of the anatomy of the joint. You also talked about the force of the fracture and the type of fracture you may sustain based on the trauma. As a surgeon, what are you assessing when the patient comes in with a fracture? What are you thinking about?
There's a lot of things that go into it. Just from a purely kind of anatomic standpoint, you want to look at kind of how it's broken, and then you kind of think about how is the best way to approach it. As I discussed, when there's multiple breaks, there's a lot more involved in terms of planning and how's the best way to approach fixing that. But I think the first question is whether or not it needs to be fixed at all with surgery or without surgery. So really patient-related factors are really important. So getting to meet that person and discussing with them kind of what their options are. For the kind of more athletic population that undergoes this, they're going to tend to be a little bit younger. And those patients, I think, are at a better kind of position to getting surgery, depending on how it's broken. Certainly, if it's broken in a way that the kind of overall alignment is well maintained, then those people can oftentimes be treated in a cast. However, if that alignment is disrupted in some way and can't be realigned, then those people need surgery. The surgery itself, is generally does pretty well for patients. The goal is to kind of restore that alignment and then allow them to get back to their normal activities as soon as possible while maintaining their range of motion of their wrist. And when I say range of motion, I mean pronation, supination, turning your palm up, turning your palm down, and then getting your wrist in an extended position, like push-ups, for example. The goal is to get them back to 90% of the other side at least, hopefully by 3 months. The flexion extension of the wrist takes a little bit longer. That can take a little, kind of closer to 6 to 8 months or up to a year even. But getting them back to their normal activities and back to sport, that's what people want to hear. And that's what the goals are for the younger population. In a little bit older population, you talk to them about kind of what their needs are, and they tend to be able to accommodate malalignment a little bit better. So if they're willing to accept some losses in those kind of range of motion deficits that I talked about. With that said, having that conversation, sometimes the patients, are a little bit more active and, don't want to accept those things. Those are the people that end up getting surgery.
Yeah. Okay. So if you do need to put hardware, some type of metal plate or wiring, does that hardware come out when the bone heals, or you just leave it in there?
Typically, we try to leave that in forever unless there's a problem, which, can develop from hardware that gets put in. Kind of standard way is to put the plate kind of on the palm side of the radius. And that's pretty deep in there and typically doesn't cause people problems. However, if issues arise, the plate can always come out at some point, but that's not usually the plan. I think people usually are asking me whether or not they're going to get stopped at the airport through the metal detector or things like that. And, the way that the plates are made, they're so deep in there, it's not usually a problem.
Yeah, Dr. Peng, I could talk to you for hours about this. Thank you for your time and your explanation of wrist fractures and repair and outcomes. Thank you for joining us again.
Yeah, absolutely. Thanks for having me.
We've been talking about wrist injuries and the like with Dr. Eric Peng. And again, more information, ericpengmd.com. Shannon, I imagine you guys deal with wrists a lot with regard to folks at your IRG locations.
Tom, we're very fortunate to have a number of practitioners that have a CHT certification. That's a certified hand therapist, very rigorous test with extreme knowledge on hand and wrist injuries from the elbow down.
More information, irgpt.com. Final segment next on Como.